When people start to have sleep issues like insomnia, the instinctual go-to is to see a doctor and get a prescribed pill to fix it. Yet the truth about those medications is that they only help for a little while. They are designed to be temporary and maybe can get you through the first stage of sleep, but not very helpful for the rest of the stages. But don't take my word for it. Take a doctor's word. And in this episode of The Why Behind Your Z's, I interviewed Dr. Arjun Iyer, a California-based emergency medicine physician who also teaches up-and-coming doctors through the United States Licensing Medical Examination Program and its podcast, Audio Breaks. We have the right prescription for you in this episode of The Why Behind Your Z's. Welcome to the Why Behind Your Z's podcast, the show that helps you maximize your sleep one night at a time. Brought to you by sleepyoudeserve.com. As I said in the intro, Dr. Arjun Iyer works two jobs, and I wanted to understand what brought him into doing both the ER work and medical education.
I consider myself lucky. I very much picked a road less traveled by right out of residency, and it was honestly, I didn't have a ton of support for what I was going to do. Basically, splitting my time between half-time clinical and full-time med ed. First of all, I make a lot less money doing it, as should not surprise anybody. But also, I think there was the concern by a lot of people, some of my mentors, my parents, that, you just finished your training, man. How are you gonna, are you just gonna graduate, barely practice, and be a bad doctor? And I'm like, I hope not. I hope the two can be synergistic in a way. And I think they have been. Emergency doctors end up thinking kind of algorithmically a lot of the time. My foundation in medical education makes sure I can sort of take it back a little bit, understand the physiology of what's going on, take a little bit more of a cerebral, slow approach, and also appreciate a little bit what I'm doing. It's easy for it to be like grinding through shifts if you're doing night after night after night, but when you're teaching it to someone, it's you remember why it's cool.
And you're learning it too, and then you get that experience of watching people learn. It's like, oh yeah,
totally.
That makes it. And I imagine, like, after a period of time in the same place, you start seeing the same things come in.
You do. That's true of any medical specialty. But one of the reasons I picked ER is because it's least true for emergency medicine. There's always something that's going to surprise you. I usually work about 8 nights in a row. And during a stretch of shifts, it's an unusual night that at least half the nights I don't see something that would make a great story later.
I asked him about any sleep-related cases he had in the ER. He brought up 2 that were a wake-up call about what it can look like when you don't sleep.
The majority of things that I see in the emergency department where the person says they haven't slept for X amount of time are associated with something else emergent that's going on. Bipolar mania with psychotic features.
Yeah, that'll do it.
I know, right? Bipolar disorder with psychotic features is something that I have to hospitalize people for, put them on a psych hold for. And many times they will not have slept. I did see one college student, a computer programming student, just pound gratuitous amounts of energy drinks and came in unable to sleep for about 48 hours. And he shared a lot of features of the stimulant overdoses. I was like, you can really drink that much caffeine? How many did you have? I forget how much it was, but it was an insane amount. Yeah. It shared a lot of features with a meth intoxication. It was crazy.
Because even at I think it's 500 milligrams, if you have that much within an hour or two, you're going to get jitters for sure.
Yeah. This guy was tachycardic to 130 beats per minute. It was kind of crazy.
Wow.
It's pretty nuts.
I'm like, that's pretty bad. It's
if he'd had underlying coronary disease, he would have been feeling some angina for sure.
That rate, at my age, is when they say you're pushing into the fat burn zone, and I'm like, that's what that rate is. Or I got a good dance fest, and man, I'm It's like, oh, 120. That's good. You know,
Oh,
so I can
so now you
imagine.
know. So now you know what to do, man. And if you don't
Yeah.
feel like dancing, is just
You like
pound
dancing?
like
5 of them?
5 monsters. Oh yeah. Oh my God. The worst thing I got was this person with crippling anxiety who was on 3 different categories of anxiety medication, hadn't slept in 2 or 3 days, and his mom brought him in and said he really needs to sleep. He's just pacing and pacing and pacing. Can you just sedate him? I'm like with all these medications he has, the only thing I could give him is like propofol drip. And she's like, yeah, do that. I'm like, no, no, I'm going to stop him from breathing, man.
That's Michael
Um,
Jackson.
yeah, absolutely
Yeah.
not. I'm not going to keep him here and, you know, be like inches from intubating him. Like, so I get it. I mean, it seems awful, but I don't have a good solution for you, man.
Yeah. Yeah.
But
I can imagine. What does Dr. Arjun have to say about cannabinoids for sleep?
I would always advise people to be cautious of nutraceuticals, mostly because, and I know this is such a classic doctor thing to say, like, nutraceuticals, melatonin, blah, 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 blah. Honestly, there are active phytochemicals in many of these, but they're not regulated at all. They
Right.
could be putting anything they want in these at any dose, at any concentration. There could be a variability range that just,
Mm-hmm.
you know, plus minus
That's
50
my
to
big,
100%.
that would be my biggest concern. Like,
There's
right.
absolutely insufficient regulation.
Right.
So they will not give you the reliability and predictability of a pharmaceutical agent.
Right.
For that reason, I would always be cautious before recommending a nutraceutical, of which CBD is one.
Dr. Arjun and I share some common thoughts on the use of prescribed medications for sleep. I tell him my experiences and asked about off label prescriptions. Hear what he has to say after the break.
Hi, this is Jen,
And I am Mira.
and we are Creative Copes Podcast.
Yep, we're just two friends who decided we had something to share with the world, and at the same time, try to end the stigma and raise awareness about how it is to live with chronic
And mental illness. We are here to share our ways of creatively coping, trying to break free from the minefield of survival mode and to start living fully.
We already have some creative coping strategies in our arsenal.
But on this journey, we will discover many more ways for us all, audience included, to deal with the struggles that come with dynamic and invisible disabilities, whether they be physical or mental.
We hope to bring some fun moments and open conversations. Please join us.
Love and light.
Beautiful humans. Okay, bye.
Mwah.
Thanks for sticking around. You've been listening to Dr. Arjun Iyer talk about sleep. We chatted a little bit about the use of cannabinoids, but now I wanted to talk about prescription meds for sleep, to include off-label use. So,
The thing with us, is that there's a difference between what is low-hanging fruit for us and what is low-hanging fruit for patients. The lowest hanging fruit for us that allows us to pat ourselves on the back and say, oh, what a good doctor you are, you said the right things, is the sleep hygiene stuff. Much harder for patients to actually act on.
right,
The easiest thing for patients is for us to give them a drug.
Mm-hmm.
That is fraught for us because all of these drugs have side effects. Many of these drugs do not, or have limited evidence for efficacy. And most of them are going to interact with something else, especially if the patient has comorbid psychiatric disorders.
Yeah.
There's stuff that's going to interact with other stuff, and you have the potential for all kind of badness to ensue. You have the potential for dependence to ensue. And now all of a sudden, as a result of acting and doing something and giving the easy fix for the patient, you've caused harm.
Yeah.
So
Yeah.
what's easy for us is not easy for the patients,
So,
and vice versa.
So in you saying that, some of the stuff, like, fortunately for me, like, I had been prescribed stuff for anxiety like a long time ago, and I was able to come off of them after 3 months, and that didn't come out with a hiccup, because after 2 weeks it was like, oh, I feel great, I don't need these anymore. And then 2 days later I'm like in a corner like literally any corner crying.
Oh,
I was like,
jeez.
I'm just like the commercials, It was like, and the doctor was like, you're not supposed to do that.
It's for real.
You
I
have
mean,
to,
the withdrawal is for real.
wean off of it. You have to, because it's really producing stuff your brain is supposed to be producing for you. So if you want to get back to that, you got to do things that made you produce those good things and wean off of it. I was like, okay. So I'm imagining now, decades later, and I'm reading about the things I never had to take, like Lunesta, Ambien, all this stuff, and everything I read is like for 6 weeks, no longer than X amount of months. And then I turn around and I see people, they're like, I've been taking Ambien for 2 years. I'm like, I don't think it's supposed to be for that long, or I've been on Lunesta, or I'm like,
Yeah.
what doctors, if it says this, how are you?
Yeah.
What
So
happens when people take these things longer than they're supposed to?
So just because it makes the patient feel better or decreases the time to sleep, is that really performing the same restorative functions, the same benefits to the immune system, the same benefits to memory consolidation that, real sleep with its like very masterfully orchestrated progression of, brainwave events? Like, are these drugs really doing that just because you feel better in the morning or you feel like you went to sleep faster? There's a limit to what we know about this sort of stuff,
Right. I want to ask you about off-label prescriptions. So this is something else I've seen when people say, have you had Seroquel prescribed for sleep? And the first thing that thinks in my head is like, okay, I worked with homeless clients that had severe mental health disorders. I've worked with people who had severe mental health disorders that weren't homeless. And I had a lot that had psychotic features. I had a lot that were schizoaffective. They'd straight tell me like, yeah, I was supposed to be on Seroquel. It did help, when I took X, this amount, but not on it as much. So now I'm hearing the voices, So when I hear Seroquel, I know that it helps people sleep, but I don't associate it with that. What I learned was like, there's a different level of prescription. So how does that compare, getting something prescribed off label versus the Z meds?
Well, I mean, if you get something prescribed off label, I mean, I guess the simplest answer is that the evidence base for its effectiveness is not as great. And not enough people have done enough of a risk benefit analysis as to whether the efficacy of the medication is worth the side effects. Seroquel is known to be sedating, but I mean, that's not the issue. There's tons of medications that are known to be sedating, but are not prescribed for insomnia because, like I was saying, medications that sedate you, quote unquote, do not all promote restful sleep. Alcohol is sedating, but you frequently wake up in the morning feeling like absolute garbage.
Yeah, there's a lot of things that happen when you drink to go to sleep.
Totally.
That's a whole other episode and chapter in a book that I was like, sure, you're gonna knock out, but
yeah. And that's what I worry about, honestly, with people who prescribe things off-label for sleep, because it's very easy to give someone something sedating, and because it feels better, use your, N of a handful of patients, your sample size of 100 or a handful of patients you've treated that tell you, I feel better. And then, just start prescribing that. But sometimes those short-term gains are not indicative of an actual improvement in sleep quality. And that's what you get with some of these off-label medications. It's like alcohol. Like if I was really stressed out about something and, if I had a couple glasses of wine, I might wake up in the morning and say, well, actually, I got to sleep easier. And that might have worked in that one situation. But if I were to do that in the long run, it certainly would not be a good or effective solution.
That was the night you didn't wake up and have to pee.
Yeah, totally.
Or your brain wasn't completely dehydrated and so you got all these nasty plaques.
Right. Exactly. You wake up in the middle of the night multiple times because now your mucous membranes are all like just like sandpaper.
Yeah, your liver is trying to fight a poison now versus like resting and building up. It's like right for the real poisons. Your digestive system, your waste system is like, what is going on? So there's done eating and drinking 2 hours ago. What is this? So
yeah, good science is boring. The science that really rigorously vets the effects of these medications in the long term when prescribed to patients over X amount of time, make sure it works in a vast array of patients. It's boring, it's time consuming, and it's much easier, to use certain things off label. But I think that you always run a risk with it. Even if you feel better in the short term, it may not be safe in the long term.
Yeah, yeah. I know that folks have had even the Z meds prescribed because jet lag, there's something temporary, or I've seen it to where like if you're going through chemo and you're not gonna be in the strongest immune system, you're not gonna really be ready to sleep like you want to,
Yeah,
but the chemo is going to end, and so this is so if this is gonna help you go to sleep, fine. If
totally.
you've got massive jet lag because you lived in Sweden for 3 months or
Mhm.
whatever, and now you want to get back to okay, I see that, or you just gave birth, so your sleep
Mhm.
cycles are way off. Now your
Yeah.
kids sleeping through the night, but now you're not. It's like okay, I can totally see where these type of medications can
Hmm.
help get you reset in addition to all the other things. But like sleep hygiene is to me is still too broad of a word to say you got to get better sleep hygiene. But what I also feel like is if there's things that you already know are an issue, like I know I've got anxiety from work. I know I'm overstressed because I know these are the things that are happening, but why can't I
Yeah.
sleep? Is like, well, you got to address those things. Doc, don't you have something you can give me just for now? That's where I see it. It starts to steamroll into a problem.
Yeah. And I'm gonna say that that is a very, 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 very common problem, because I think people will write certain elements of sleep hygiene off as impossible. Like, oh, I've always got to be accessible by phone because of X,
Mm-hmm.
or I always have to, like, what if my mom texts me in the middle of the night? Tell her
Yeah,
don't text me at the
all the reasons, all the
yeah,
things that have probably happened
yeah,
when you were asleep and the
yeah.
world was still functioning. Now that we've talked about what people take, what does Dr. Arjun believe is the best way to address sleep issues like insomnia? Well, as a doctor, you might be surprised that what he recommends doesn't come in a bottle. You might also be surprised that Dr. Arjun and I also find that you sometimes have to make counterintuitive changes that will help you sleep better.
I'm the Western medicine guy. I am supposed to be the pill pusher.
Yeah.
And I will say that the number one safest and most evidence-based thing to do is all of these rituals and cognitive retraining exercises that tell your brain, this is the final scene of the daytime.
Day.
This
Exactly.
is what leads into
Yeah.
a deep, restful slumber.
Right.
These
Right.
are the most effective and the safest. And when you put it like that, it's like, why would you not do this? Well, because it's hard. It takes some doing to kind of get into the rhythm. It's not hard like, bench pressing 300 pounds is
That's the
hard.
only way you're going to save yourself is to bench 300. But like, no, that would be hard.
Yeah. No, it's not like that level of
Yeah.
hard,
Yeah.
but it's like being consistent is hard. As a Western medicine doctor, um, even I will acknowledge that there is something so important about the sleep wake rituals, like the things you do in the morning to sort of get yourself in the rhythm of your day.
Yeah.
And I will fully acknowledge that I have a completely awful night ritual. I don't have any night ritual. I just do whatever I want. Things that you're not supposed to do.
Yeah.
But I got a pretty good wake up ritual
That's good.
where I'll wake up at like 3 a.m. when I'm not doing shifts because like I apparently hate myself. But like I'll do the chores, the things that are mindless, the things that'll get me grubby, like scoop the cat litter, do the
Yeah.
dishes. Then I'll have a nice refreshing shower after it. I'll take my time. I won't rush. And I'll get out and then ready to face the day. By then my coffee will have kicked in and
Boom.
ready to hit the day.
Yeah.
I have a good wake up ritual,
That's
but
good.
these things are important, like these behavioral patterns that
Yeah.
allow allow your body the signals it needs to recognize when sleeping and waking must occur.
Yeah. Yeah. I think we need to do more of easing into waking up and easing into going to bed, no matter
Yeah.
what it is that you do during the day. Like the more you can do that, the easier it is for your brain to get the rest that it needs. And if you're going 100 miles per hour and you decide now I'm going to go to sleep, your brain's still going 80, 70.
Oh yeah.
It's still firing, and that's what happens. 2 hours, you're like, what is the square root of zinc? Why am I thinking about this? It's like, well, because you never really slept.
Did you just say the square root of zinc?
Yes, that's what I said.
That's fantastic.
If you think about stuff like that, it's like, oh, man, why does this got me awake? All right, let me go scroll and find out. Like, oh, babies. Oh, babies. So
I just had that happen last night. Actually, I was awake, just anxious about something to do with my work and how I was possibly going to get stuff done with the budget restrictions and anyway, stuff that nobody cares about, but usual work stuff. But sometimes sleep has just forsaken you, and I don't know, for me, when anxiety is the reason, I do something that I know is going to de-stress me, which obviously is not play the bass because it's 11 at night. Obviously, I'm not going to do that. But I ride my one-wheeled electric skateboard, just and at 11 at night, hardly wind's out. You should rip up and down and just go fast, feel the wind in your face, and you come back, and it's nice.
You're ready to sleep. Yeah. So if you know that anxiety is what is keeping you from sleeping. I feel the same way. I'm like, there's nothing wrong with doing something active. That's not going to warm your body up too much, but it's going to take your mind off of that, because that is what it is. It's not necessarily chemicals. It's not necessarily like, this is what's keeping me up. Let me go freaking go do something. Other times I'm like, hey, if you wake up in the middle of the night and you're used to getting on your phone or whatever, don't do that. Like, go to another room, grab a book, go to another room. Don't think about when am I going to get back to sleep. Just go do something else. Like, go fold the laundry. Do something.
Right.
You will.
It's always something physical is always what helps for me. And by the way, this is not Arjun the doctor's recommendation. Right. This is Arjun the person who every now and then has a hard time getting to sleep recommendation. If I know it's anxiety that's keeping me awake, like, I'll take the hit to my sleep hygiene. Like, is it great to like rip up and down the streets on a one wheel and then go to bed? No, it's not. But
you'll probably
it de-stresses me.
Though. But see, I feel like if you know that it's anxiety and that's going to de-stress you, you're probably better off doing that for an hour, knowing that you're going to go sleep for a good 4 or 5 more hours versus I'm going to force myself and I'm going to keep waking up every hour. Like, to me, I'm like, take the L in that hour, because the other 5 is better than 1 up, 1 down. Yeah, you
hit the nail on the head. Just take the L. It's not the best thing to be doing right before you go to sleep, but maybe it's the better thing to be doing.
Right. And I'm doing the same thing with my allergies. I now, some nights I have to go fall asleep in another room. So I don't keep my wife up because I'm coughing all the time. It's like, if I can fall asleep for another room and get a good 3-4 hours, I know I'm going to wake up at some point. I'll go into the other room and I'm going to fall right back asleep before my body figures out you're allergic, remember? Before that's and I'm going to sleep another good 3 hours. Well, that was a great interview with Dr. Arjun Iyer. I'm forever grateful to know people like him who are experts in the medical field and really, really care about their patients enough to go with what they know to be true and not just what other doctors have ordered. Hopefully he's opened your eyes to treatments for insomnia, the risks with prescribed meds and supplements, and what works best in the long run for chronic insomnia. CBTI. As a sleep coach, I was happy to hear that. While I don't use CBTI practices in their entirety for my coaching methods, I definitely pull some elements to help create a holistic, personalized approach to helping you get the sleep that you deserve. That's something that I want, and Dr. Arjun Iyer would want for you too. Here's to a good night's sleep. Thank you for listening to another episode of The Why Behind Your Z's. For more information and additional advice on how to help you get the sleep that you deserve, check the show notes for our email subscriber list. You can also visit our website, sleepyoudeserve.com.